I got in with the best pulmonologist in town right away, which was a privilege because I had worked with him. I'm a registered dietitian in the hospital. When I would cover ICU, I would work with him. He wasn't usually taking patients, but so it was a real privilege that I got to see him. I went in, and of course, he had me do the spirometer too. Eventually, we ended up doing some imaging, and he said I did have the ground glass opacities in my lungs. And he explained what that meant, that it's never going to heal. Those are dead cells, and how it's critical that I get this under control. And he said, there are about 300 different kinds of ILD, but knowing your history and that you have about 4 autoimmune diseases, I think this is your 5th. He said, if you really wanted to know, the only way to know what type you have, because I've had some exposures in my past. I lived in a house that had black mold. My first job in my 20s, I was an offset printer. And in those days, we cleaned printing presses with methylene chloride, which is what they used for gas in World War I. So I had some other exposures, and he said, it's possible it's that, but I'm really pretty darn sure in your case it's autoimmune. He said, the only way we would know is to do a lung biopsy, but because you're so immune compromised and on immune suppression, that would be unethical for me to do that.